I am going to go on to my next slide. So welcome everybody. This is Mastering NHS Interview Like a Pro. I would like to call it a masterclass, but it's essentially just a little bit of a conversation, making you acquainted about how NHS interviews work. So what I'm going to cover today is what you need to know about the NHS interviews, essentially. We'll talk about how you get your application to be strong enough to win you that first interview. Then we'll talk about how these interviews are structured. We will talk about how shortlisting works, and this is something that is an interviewer secret, and it will help you prepare better for the interview. We'll talk about some common themes for interview questions. I'd also talk about slightly in detail about structuring your answers, and I'll give you a few structural frameworks that you can use while you structure your answers for NHS interviews. Then, of course, because I like advising people a lot, I will tell you what should you do and what you should absolutely avoid when you're sitting for an NHS medical interview. And at the end, I'll give you some more resources and how you can get in touch with me if you wanted a mock or any other help with preparation. So when it comes to an NHS job, I think equal importance is given to how you apply for the job and then eventually how you interview for the job. Now, before we move on to the interview bits of things, I think I'm going to talk to you briefly about how you can optimize your medical interview applications. And the most important thing, Harish, could you please switch off your mic? Thank you. So how do you prepare for a robust application? The first and foremost thing, and this is something I tell all my mentees, is that you need to absolutely know the job description. Do not apply for an interview knowing that you do not meet the essential criteria, because it's going to be a waste of time for yourselves. You might face rejection, and that's not a very nice feeling, to be honest. If you keep on applying incessantly to hundreds of jobs without even knowing the job description, I think it will consume a lot of your time, consume a lot of your energy, and then you wouldn't be able to actually focus on that one job where you could have actually made it work. So know your job description, only apply to the jobs that you are eligible for. Look at the essential criteria, read the person's specification. It tells you exactly what the interviewers will be looking at when you apply for the job and when you come for the interview. It will give you the things, the competencies, the qualifications, the other non-clinical bits that they're looking at. So read the job description and read the person's specification. And that's the one most common advice I give to everybody. And I would call it a rule of thumb before you apply for any job in the NHS. Again, when you write down the application answers, be wary of the fact that more doesn't mean better. So tailor your answers, be specific, be very concise. I know there is a lot of impetus in the entire medical fraternity about using AI and things, but I would still suggest try and keep your applications as specific and as authentic as possible. As much as I hate to use the word authentic, I would still want to see you as a person, even if you make a spelling mistake or even if you're not using grammars properly. That's absolutely fine, so long as you are tailoring your answers to the specific questions and being really honest and authentic. Stick to the point. Do not write essays. As an interviewer, I am given hundreds of applications to shortlist from, and I am given only a few days to make that work. So the applications that stand out the most are the ones with very concise and precise answers, the ones that are not giving me long essays under every question, the ones that are highlighting the points, bulleting the points, and the ones that are actually that are actually very specific to the questions that are asked. So if we are asking you to write about, say, for example, your QI experience, I don't want to know your QI as a project with all its specifications and all the details. What I want to know is, what's the title of your QI? What motivated you to do the QI? What did you collect in a very short sentence? And then how did it change practice? And that's pretty much it. You don't need to give me the absolute details of what kind of data you collected and how you presented it and this, that, blah, blah, blah. No, nobody has got that time, that energy, or that patience to read through the entire application. So keep it as precise, as pointed, and bulleted as possible. Before you come for the interview, or even if you have put up your application and you are in that phase where you're waiting for getting shortlisted, read through your portfolio, read through your CV, summarize your CV in three or four short sentences. I usually prefer the answers to be very short, 3 or 4 minutes at max. As interviewers, we don't have a long attention span anyway. So keep them as specific, as short, and as summarized as possible. Do not bluff. And that's a very, very important point to remember, because whatever you are writing in your application, in one way or the other, you will be asked to tell about those things in the interview. So please be sure that you're not bluffing, you're not making things up, and you have written absolutely the truth in your application so that you can then tell us more about those things in your interview. And to be very honest, nobody is perfect. If you're applying for a job, you will not have all the essential or all the desirable criteria, and that's perfectly fine. Some of you may not have done a QIP, some of you may not have done research, some of you may not have any teaching experience, but that's okay. All you need to remember is that when you go into a job, there are certain things you bring to the job, but there are also certain things that you learn on the job. So it is okay to not have everything, and you should not panic if that's the case. Now, these are the 3 points that I'm going to discuss going forward. What do you need to do before you go for the interview? So say you have been shortlisted for the interview. The things that you need is preparation. And by preparation, it's not just reading about the things. It's not just polishing your clinical acumen. It's not just about doing mocks and other things. It's also about preparing yourself for it, trying to stand in front of a mirror, talk to yourself, answer the questions like you would answer in an interview, and do some kind of practice. If you've got colleagues who are happy to do a mock for you, it's much easier to do it with somebody who knows you. It's much easier to get their feedback, and you wouldn't feel bad even if they say they ask you to improve upon certain things. So practice is very, very essential. And then eventually on the day of the interview, you are going to perform. It is like a performance. It is marketing yourself, putting yourself out there as a person, as a clinician, and as a leader. So do not be afraid of saying things. It's not an exam. It's not an assessment. People are not assessing you. They're not marking you. They're not grading you. What they're looking for is somebody who can integrate into their team, integrate into their system. They are looking for somebody who comes across as polite, who comes across as clear in their ideas, who comes across as knowledgeable, skillful, but at the same time, who also comes across as a person who is good to talk to. So you have to be within yourself. You have to be yourself, absolutely. You don't have to be somebody else or act like somebody else. Just be yourself. Some people get really scared when English is not their first language and they're sitting for an NHS interview which is completely going to be in English. But that doesn't matter. So long as you know basic English, obviously all of you know basic English, how you put your thoughts forward in the most simple, in the most clear form, and that's about it. No one wants you to have very complicated phrases and words and proverbs and idioms in your language. Just keep it as simple as possible. Just use simple phrases, simple words. Try to speak in a flow and not use a lot of filler words, and that's pretty much it. So you're there to perform, but that performance shouldn't hold you back, and do not get pressurized because of that. Now, the next point is, how do we structure your medical interview? So as interviewers, we have a fixed set of themes on which to test you, on which to interview you. And these things are broadly classified into knowing you, clinical questions, and non-clinical questions. Now, knowing you. So we want to know you as a person. So pretty much all the NHS interviews will start with, tell me something about yourself. But that doesn't mean that you take them through your entire history, geography, biology, and everything else. What we mean by that question is, tell us who you are, what you do, for how long have you been doing it, what are your aspirations for the future, and why have you applied for this job? That is pretty much what we are asking you to explain to us. And if you would have summarized your CV and practiced it with somebody, you would know exactly what to tell us. So you need to know yourself first before you come across and tell us who you are. Okay. So try and prepare that little answer in your brain and repeatedly try and practice that and use it to explain to the interviewer with a very short attention span who you are, what you do currently, what was your last job, where have you come from, what are your aspirations for the future, and what next, why this job. So that's pretty much it. Then comes the clinical questions. Now, I'm not going to go into details of clinical questions because you know your clinical bits, you will prepare for it, you will have a clinical acumen, you're all doctors, you are intelligent, you know your specialty. If you're not in any specialty, you have done your MBBS. So you have a fair idea of what kind of clinical questions can be asked. To be honest, mostly the clinical questions are very basic. They would usually be around some form of resuscitation or some form of acute case management. How would you treat a patient who comes to you with severe asthma? Or how would you treat a patient whose saturation are falling in your ward? Or how would you treat an allergic reaction to an antibiotic? So these are very simple questions. You just need to keep your answers structured, simple, and to the point. The most frightening thing, I think, for most people who are not from the UK is the non-clinical questions. And I'm going to talk a lot about non-clinical questions in this session, because these are the things that we do not come prepared for. These are the things that nobody tells you about. And these are the things that may not be given as much importance in the medical systems that you are coming from. For example, I come from India. When I was working in India, there was absolutely no significance attached to junior doctors talking about leadership, management, problem solving, conflict resolution, soft skills, research. I mean, we were just slaves of the system who kept on working, who kept on doing the best that they can for the patients, who would just clinically treat the patients and who would just do their job and come back home. But these days, and things are changing as well, in many parts of the world, a lot of importance is being attached to non-clinical questions, to non-clinical development. So you are clinicians, but apart from being a clinician, you are also a leader of your unit. You are also a team player. You are also working with lots of other people who have different opinions, different mindsets, different job roles. So how do you take all of that together, and how do you carry forward that team? People want to know what your personal attributes are. How do you fit in my unit? How do you fit in my team? What are you bringing to my team that is not just clinical, not just knowledge and skills, but also behaviors, but also your personal attributes? Are you honest? Are you polite? Are you helpful? Are you a good team player? Can you lead a team? Can you identify patient safety issues? Do you want to participate in research? Can you teach your colleagues or your juniors? How good are you at supervising others to do clinical things and non-clinical things? So a lot of these things are super important, and how you present and how you answer these questions makes a lot of difference to a person who gets selected in an interview and a person who does not get selected in an interview. So I'll tell you a little bit more about these questions and how you would go about structuring your answers for most of these questions. So when it comes to the first and foremost question, where somebody hits you with the question that, well, can you tell me something about yourself, or can you run me through your CV? I think try and keep it as precise and concise as possible. And I'm going to use these two words multiple times during the whole session because they're super important. You start with what you're doing currently, what you have recently done, or what was your last job. What is your background in terms of qualifications, in terms of education, in terms of where you come from, and what are your aspirations from this job? You have to absolutely avoid pre-memorized answers, because when it comes to memorizing an answer, you can pass an exam, but interviews are conversations. You have to be having some presence of mind. You should be able to troubleshoot a lot of things, a lot of questions, and you have to absolutely avoid parrot talk. So do not be vague, be very specific with what you're telling your interviewers. Again, when it comes to telling us what your qualifications are, you don't need to list all your qualifications. If you would have read the job description and if you would have read the person's specification, you would know what are the essential criteria that we are looking for, and what are the desirable criteria that we are looking for. For example, a junior clinical fellow in an acute medicine specialty, the most essential criteria would be their experience level to at least ST1, ST2, which is an equivalent of 3 years post MBBS in any other country. So if that's an essential criteria and you do not meet it, then you would not be shortlisted. Okay. For desirable criteria, so sometimes these posts will come with desirable criteria like, have you done your ALS? Have you got any additional qualifications like an MD or an MRCP or an MRCS? Have you got anything else that you can showcase? For example, ATLS or some of the big project that you were a part of. So those are the things that you would want to highlight when it comes to telling us about yourself. Most people, and I have seen and observed this personally, take this first question for granted. But let me tell you this very, very honestly and bluntly. If you screw up this question, the rest of the questions automatically get screwed up. So be very particular about practicing this question. Keep it short, concise, and avoid memorizing the answers. If it's simple, if it's in phrases, doesn't matter. You don't have to be very eloquent. You don't have to be using big English words or long English sentences. Just keep it really simple so we can get it what you want to tell us. Next comes the clinical questions. So again, as I said, the questions will be very basic. The important thing here to remember is when you are asked, how will you manage so-and-so patient? Do not generalize your answer. And by that, I mean, tell them what you will do. So I will manage an acute case of asthma by attaching them to a monitor, attaching a SATS probe, doing an ABG, giving them oxygen, giving them nebulizers, and then referring them to ITU if they're struggling to breathe. So you have to make it all about yourself. Attending an interview is about marketing yourself. It's all about you. We do not know you. So what you tell us about yourself is what we know about you. And based on that, we will select or not select you. So make it all about yourself. Talk in first person. And this is a golden rule. Again, although it is an interview and they will expect you to have some clinical knowledge, it is not a show of your clinical knowledge. So we do not want to know what guidelines you're following or what protocols you're following or what kind of biomarkers you're going to investigate for a particular case. All we want to know is if you were left in a ward and this patient came to you, what are the important first few things that you will do to stabilize this patient? And then what will be your further management plan? And that's about it. So keep it short. Tell it like a story. Tell it like you know it. Tell it like you've done it before. If you do not know something about a case, the easiest way to still sound knowledgeable is at least do the basics. So follow the ABCDE rule, and it will prompt you to then elaborate itself. For example, if you do not know anything about how you manage acute pancreatitis in intensive care, you can at least start with, I will assess them in the ABCDE form. So I will check that the airway is clear. I'll check for their breathing. If there are adventitious sounds, I'll check why that is. I'll get an X-ray for them. I'll give them oxygen. I'll help them to breathe. I'll set up a CPAP machine, or I'll ask somebody to, come and set up a machine for me. I will check if their heart rate's okay. I'll check if the blood pressure is okay. I'll give them IV fluids. So at least when you start with this, and you will automatically have a flow of ideas, and you will be able, nobody's going to ask you specifically how you treat acute pancreatitis. You will never reach to the point of necrosectomy. So don't worry about it. All we want to know is, can you stabilize this patient till you get help? So keep it very, very basic. Keep it very, very simple. There are certain frameworks that are available, but I suggest if you are an IMG, it is difficult for us to formulate answers, and we sometimes get carried away in following a certain framework or a certain plan. And if you try to answer every question, you will get stuck in between and you will consume a lot of time in filler words. So unless you're very comfortable using frameworks like STAR or SPICE, you can go and check it on the internet, what they stand for and how you go about it. Unless you're very comfortable using them, do not try to make it a habit. You will learn it on the job anyway. Again, practice will make you perfect. Well, not perfect, but at least will take you as close to perfection as possible. So practice with your colleagues, practice with your parents, practice with your brothers and sisters. Just practice talking. That's about it. It is a conversation. And always remember, it is a conversation between adults. You are not a school-going kid, and this is not an exam. Then we come to the non-clinical questions. Now, this is, as I said, the most important part of the interview. We are looking at your personal attributes. We are looking for teamwork, leadership. We are looking for words like patient safety, communication skills, and empathy, and so on and so forth. Sometimes when you are applying for a more senior job, then you will be asked certain ethical questions. And lots of us find ethical questions really tricky. Again, simple rule of thumb for answering any ethical question is say what you know, talk about patient safety. I will try to keep the patient as safe as possible. I will make sure that no harm is brought to the patient. If any harm is being brought to the patient, I will reflect upon it. I will follow procedures for reporting it. I will support the patient and the family. And eventually, I will follow the clinical governance protocols. Is the best way to answer such questions. Again, you don't need to go into the specifics unless you're asked to, but mostly if the interviewers are good enough, they will not take you into that spiral of really complicated or complex things. We know you're coming from another country. We know you're applying from another place, another system altogether. So we will try our best to give you prompts, and we will try our best to keep it as simple as possible for you. But at the same time, you need to keep it simple for yourself. And also for non-clinical questions, and this is again something I have experienced myself, is avoid generalization. Talk in first person, give actual examples. So if I'm asking you about how can you give me an example of when you showed leadership. You don't tell me that I show leadership on an everyday basis. I teach my juniors, I do this, I do that. No, give a very specific example. So a few days back, I saw this patient who went into a cardiac arrest. I showed leadership by, leading the cardiac arrest or getting the right people to come in and lead the team. And then I documented everything. And now we are doing an audit or a QIP to figure out how to, improve the response to a cardiac arrest, so on and so forth. Like, make it something that comes across as an important specific example rather than something very general. Next will be, so these are my sort of takeaway bits from the previous slide. Do not generalize, be really specific, and market yourself and your best skills. Whoever is playing with the marker, can I ask you not to? It's spoiling my slideshow. Next comes some examples of non-clinical questions. So we will go through these, and I will tell you a little bit more about them. So the most common ones that we usually as interviewers formulate the questions, and the most common ones that we ask almost everybody these days is, tell me a time when you handled a clinical error. And this goes on to say, mistakes are committed by everybody. We are doctors, but we're not perfect. We work as a team. So one person's mistake will be a representation of the entire team's mistake. And you are not held responsible alone. You always have a team you can fall back upon. So when you're asked about how you handled a clinical error, again, we'll follow the same rules as I said previously. Talk in first person, give a specific example. If you can't give a specific example, if you've never dealt with it, do not say that you've never dealt with it, you've never handled a clinical error. Just go on to say that if I was ever in a situation where a clinical error occurred, then I will do this, 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 this. And here comes the two most important things that you would have to read about is duty of candor and how you do that. It's basically going to the patient and telling them that something has gone wrong very openly and honestly, and then telling them what you would do next and how you would make sure that that doesn't happen again, and how it will be investigated and how they will be made a part of the investigation. And you apologize to them on behalf of the team, not taking it as a personal apology. And then you have to know about serious incidents or incident reporting, which is a part of clinical governance. That is something that comes across a lot of times, especially in consultant interviews and in specialty registrar interviews. Again, so you need to know point-wise what are the things that you would do when a clinical error occurs, and how would you go about making sure that everything is in place. Again, in non-clinical questions, make sure you use the power words like patient safety, I would document it. I would support the patient and the family. I would have a clear communication and those kind of things. Then similar other questions could be, tell me a time when you dealt with a difficult colleague. Again, in case of dealing with a colleague, you have to use power words like, well, I will show empathy, or I will take them to a private place. I will take them away from the patient's bedside. And then you would ask them what has happened. You would not reprimand them. You would rather speak to them professionally. So power word, professionalism. And then you would ask them to reflect upon what has happened, or if things are escalating further, then you would have to know, you have to tell them about things like, well, I will then escalate it to my bosses, or I will escalate it to their educational or clinical supervisor, and so on and so forth. So unless you have a system of answering these questions, or unless you have thought about them and pre-prepared, it may come across as a surprise and a shock when you're asked about these kind of questions, because in most other places, these things are not given that much importance, but they are certainly very important when you're coming to do a job in the NHS. Again, leadership, I've already spoken to you about, and a QI project I've spoken to you about as well. Now, I'm going to give you some interviewer secrets. So how do we select somebody for a job role? So we make sure, and this is across the NHS, that interviews are all recorded. Okay, the interviews are all fairly marked. So we use a rubric system of marking, and although this is not like an assessment, it's not like a grading system, but at least it gives us something to fall back upon if a candidate thinks that we have not played fair. So we can show them on what basis they have been or they have not been selected for the job. And it helps us in giving feedback to each other as well. So it improves, it takes away the bias from the whole system. It gives us a structured methodology to try and select the right candidate for the job. But again, not too much importance on marking system. More importance is placed on how the interviewee come across as a person, as a doctor, as a clinician, and as a leader or as a team player. So again, it's very important you talk about things like you're having a conversation, because it will help you ease into the conversation, into the interview, and do not take a lot of pressure if there is something that you don't know, or if there is something that you've heard for the first time. It's okay. Again, know that we are doing a continuous assessment of you. Well, not in the real meaning of the word, but we are looking at your body language. We are looking at your soft skills. We are looking at your confidence. We are looking at your behavior. We are looking at how easily you're able to answer the questions, or how difficult you're finding it to answer the questions. And we are humans. We do understand that some of you will be in a very sympathetically stimulated state when you come for an interview. If you need a break, just ask for it. If you need a glass of water, just keep it with you, ask for a break, have a glass of water, and come back and answer the question. If you feel very stressed about something, just tell us that you need a breather. We can wait for a couple of minutes. We can let you breathe. It's absolutely okay. And it actually shows how emotionally regulated and emotionally intelligent you are, that you are able to acknowledge that you're not feeling well, or you're not into the substance, or you need a little breather. That's absolutely fine. What are we exactly looking for is, we are looking for a team member. So we are working as a team. I speak for ICU. ICU is a close-knit team. We want to find a good fit for our team. We want to find somebody who will be adaptable, somebody who will be able to resolve conflicts, somebody who will be able to join the team as a team player, as a team member, somebody who will be able to lead a good team. And obviously, we're also looking at your personal values, and we're also looking at how your personal values kind of collaborate with the trust values. So this is one point I would want to raise here, is when you are applying for a job, um, especially in the NHS, all the trusts have trust values. So I would recommend you go and read those values, or at least know the words. For example, there would be trusts with trust values like compassion, honesty, companionship, teamwork, empathy, those kind of things. And if you have those as your personal attributes, then you can tell us that, you know what, I am a very empathetic person and my core values are pretty much similar to what your trust values are. So that kind of tells us that you have done your homework and you have gone and read about the trust, and you're not just there looking for a job, but you're there to get integrated into the system as well. Next comes the things to do. So these are the essential things that I would recommend you do for when you're appearing for an interview. So being punctual is really, really important, because as interviewers, we don't get a lot of time on hand, and we are probably interviewing a lot of people together on a single day. So unless you are punctual and you join on your slot time, it is very difficult for us to give adequate time to other people. So be punctual. If you are attending an online interview, make sure that you are there a few minutes in advance. You have checked your internet connection, you've checked that you've got good audio and video set up, and you're dressed smartly. It doesn't matter if this is an interview you're joining from home, we can still see you, and it is as good as being face to face, but just remotely. So the codes, the norms still apply. Be punctual, dress professionally. Come across as confident. It's okay if you don't know anything. It's okay if you're an introvert. It's fine. But when you're coming for attending an interview, that is then a major milestone in your career, and you're setting yourself to perform, to give a performance. Be confident. You have put in the hard work. Acknowledge that you have put in a lot of hard work. You know your things. You have a clinical acumen. You're intelligent, and you can troubleshoot as a doctor. You must have seen so many patients already, and you must have done so much work back home. Carry all of that as your strength. Do not get taken aback by questions, by language, by terminologies that you're hearing for the first time. Does not matter. Just know your thing, know yourself, and come across as confident in what you do. Prove to us that we need you and not the other way around, is what I would say. As I said, breathe, know your strengths and weaknesses, and prepare well. And by that, I mean not just in terms of preparing the theory, but also in terms of preparing yourself mentally, how you're going to come across. Are you hydrated enough? Have you fed yourself? Are you feeling at ease? Are you, you should be in your element in a way to come and speak to somebody who is going to ask you a few questions. And the things that I usually ask mentees to avoid when they're sitting for their interview. So it comes across really poorly if you're waffling and bluffing. By that, I mean, we don't want big stories. We don't want essays. We don't want a memorized answer for anything. And we certainly don't want a lot of filler words. And we don't like generalizations either. So what you can do is you keep it as short as possible, as simple as possible. Use the power words. Do not use the filler words too much. And if you need a break, if you need to pause, just pause, regather your thoughts, and come back. That's fine. Instead of just sitting there and doing a lot of I don't. I mean, that comes across as really, really odd and awkward. Then comes the negative words and phrases. So even if you do not know something, even if you haven't done something, you have not got the experience of something, I would still absolutely avoid words like, I don't know. I would rather say, well, this is the first time I'm hearing about it. I would like to go back and read more about it. And I hope when I join you and your team that you will teach me about it. So this answer itself tells you that you are keen to learn, that you are a learner, that you don't avoid challenges. This is what we want from you. When it comes to situational questions or non-clinical questions, again, don't say you've never faced it, because you might face it when you join us in our team. So the story will then just change a little bit to say, well, if I'm ever going into that situation, this is what I think I will do. Again, it comes across as positive instead of negative. If you're asked things about, well, have you got any other interest, for example, research, do not tell them bluntly, even if you don't have an interest in research, you don't tell them bluntly that you don't have an interest in research. Tell them, well, I would like to explore it more. Again, it turns that whole negative phrase into a positive phrase without even compromising your stance. So that's how you do it. Again, there'll be ethical questions that sometimes will challenge your belief system, but don't say you don't believe in it, but just say, well, I would like to read more about it, or I would like to explore this a bit more. And that's pretty much it. There is always a slot at the end of every interview where the interviewers will ask you if you have any questions for us. And I've seen a lot of candidates asking really odd, awkward questions like, well, what's the salary for the job? Or will you give me a work visa? Can I do private practice? And so on and so forth. I mean, these are the questions for HR. So when you get the job, these are the questions that you can go and ask the HR or email them and ask and clarify from the HR. These are not things that the interviewers would know. On the contrary, what the interviewers will know are these things. So sometimes when candidates are asked if you've got any questions for us, most of them just say, well, no, I don't have any questions. But again, if you have to stand out in an interview, have some questions, because definitely there will be some burning questions happening. It's just that you don't want to ask, or you just want the interview to end. But don't lose this opportunity to show that you are actually interested in their team, or you're actually interested in working for them. So ask things like, well, what are the various educational opportunities that are available in your team or in your department? How is the work culture in your department? Or ask about what projects or what research things are they doing in their department? What will I get some opportunities to grow and progress in my career? Ask about what they as a team, like we as a team, are facing. What are our challenges? What are our strengths? Know the place that you are applying for and want to go to by asking them firsthand. This will sound more professional. This will also show them that you are really interested in the job. And I totally get it. Money is a big driving factor. Geography is one of the bigger motivations to apply for a particular job in a particular place. But those things are not the things that you would discuss. The other things that you can ask about is, how does the rota work? And am I going to do on-calls, or am I going to be doing nights? And is there any chance of doing flexible working? And those kind of things. So these are the questions that you would want to ask your interviewers at the end of your interview before you end. And I will end this session by this very important quote. And this is quoted by myself. When you have an opportunity, make the most of it. If you succeed, good. If you don't, you learn. No opportunity in life is ever wasted. So that pretty much concludes everything I had to say for an NHS interview. I am these days trying to organize mock interviews for people who are struggling So I'm happy to do a one-on-one mentoring session. You can try and book that on my website, or you could just get in touch on LinkedIn or via my email. I would be delighted if you could scan the given QR code and provide me a little bit of feedback for the session so I can organize more sessions and help more people. I will now open the I'm now going to open the Q&A session. So if you've got any burning questions, please raise your hands or just pop in.